Good afternoon, everyone, and thank you so much for joining us today for our Facebook Live. My name is Gabby, and I am here with Dr. Heather Gomes from Boys Town National Research Hospital, and we are going to talk through ear infections today. So ear infections is a common thing that a lot of kids will deal with in their adolescence, and today we're going to provide different tips and knowledge on ear infections to better prepare parents for when they happen and how to manage them and keep your little one comfortable. So, Dr. Gomes, how are you doing today?
I'm good, thank you.
Good. If you want to start, can you tell us just a little bit about your role at Boys Town?
Yes, so I am one of the otolaryngologists or ear, nose, and throat doctors at Boys Town National Research Hospital. I've been here for 10 years and do clinic usually at the 30th Street location and in Council Bluffs.
Great. Well, it's so nice having you. So for all of you who are watching live, we have a list of discussion questions we're going to go through. And if you have any questions for Dr. Gomes as we go through our discussion, feel free to leave them in the comments section and we can get them answered at the end. So Heather, the first question is, what are some symptoms of ear infections?
So this can vary in children, but generally ear pain, fever, often associated with an upper respiratory infection, like with cold, nasal congestion, runny nose, sometimes a cough. Those things often go together, and the nose sort of plugs up, and then you get fluid in the ears, and it usually manifests itself in those ways. Some parents notice difficulty hearing, but probably fever, ear pain, nasal symptoms are the most common.
What are the different types of ear infections that children can develop?
So those are kind of two. So otitis externa, which is an infection of the ear canal, usually related to water exposure or swimming or maybe trauma. And then there's otitis media, which is an infection behind the eardrum that usually needs antibiotics to treat. Otitis externa you can usually treat with just ear drops.
Okay. So when do children typically get ear infections? Is there a common age range or a typical environment that can make them more common?
Sure. So they are more common in younger children, and generally as the facial skeleton grows and there's more space at the back of the nose, the ears don't plug up as easily. So more common in younger children under the age of 5. After that, a lot of kids will slowly outgrow it, some sooner than others. But there are even some people just have tough ears, and some will kind of struggle into adulthood as well.
So what should parents do if they suspect their child has an ear infection?
So they usually should see their primary doctor or their ENT, depending on if they already have one, and get appropriate treatment, which is usually antibiotics, maybe something for the nose or something like that, or ear drops if it's just an otitis externa or something like that. And if it's taking a little while to get in or something, ibuprofen never hurts and usually helps at least manage the symptoms until they can be seen.
How are ear infections diagnosed?
So you really to know, you've got to look in the ear. So that is really the only way to accurately diagnose an ear infection is to get a good look in the ear and see what it looks like.
Yeah. And then you talked about a couple treatment options. Are those the main two, the drops, and then what was the other one you mentioned?
So if it's an otitis externa or an infection of the ear canal where it's the skin, then topical drops and honestly cleaning out the ear are the two main treatments for that. Now, occasionally that will require oral antibiotics, but most of the time it doesn't. Just no water exposure, keep the ear dry. For an otitis media or an infection behind the eardrum, the mainstay of treatment is oral antibiotics to help clear the infection and hopefully the fluid. If it's draining, if the eardrum is ruptured and it's draining, then you can add antibiotic ear drops to that, and that can be helpful also.
Great. So sometimes ear infections can be a little bit painful for kids. So what advice do you have for making our children more comfortable when they do have an ear infection?
Yes, so Tylenol and ibuprofen are probably the mainstays of treatment, and sometimes you can just alternate those two things every 3 hours so that kids don't get too much of one medication or the other. So that's for pain, and then sometimes like a warm pack or a heat compress can kind of loosen up those muscles and help things like open up. And help the ear at least equalize pressure a little bit more. And then treating the nasal congestion also helps take down some of the pressure.
What should parents do if their child is getting reoccurring ear infections?
So frequent ear infections or persistent fluid probably warrants at least an initial ENT evaluation to see make sure their treatment up to this point has been appropriate. If there's a family history of middle ear dysfunction or ear trouble or need for tubes, then it's probably more likely that the child might benefit from further intervention. So start with an ENT evaluation.
Great. What services does Boys Town Ear, Nose, and Throat provide to care for children with ear infections?
So the mainstay of treatment is just a good ENT exam and then a hearing test. I do think most kids who struggle with ear infections should at least have that. And so we start there, and then we offer the entire gamut of treatment for really any otologic or ear problem in children, all the way from surgical interventions such as ear tubes, all the way to something like a cochlear implant for deafness, but for ear infections, there's different surgeries depending on how significant the problem is.
Great. So our last question here is, what is one thing that you think parents should take away from this chat about managing ear infections?
That's a good question. I think that ibuprofen, for sure, to help manage pain, and definitely if your child is on antibiotics more than 4 times in 1 year, or 2 times in 6 months for ear infections, I would at least recommend an ENT evaluation. Antibiotic resistance continues to grow, and if we can sort of minimize the amount of exposure children have to antibiotics that are unnecessary, to make sure that there aren't other things that can be done. I would just say, if it seems frequent and you're at the doctor all the time for their ears, that probably it's time to get an ENT evaluation. And then you want to make sure that hearing is okay, and really, because sometimes fluid in the ears and struggling with this can cause trouble with hearing, and you don't realize until they're 2 or 3 that there's speech concerns that go along with that. And Boys Town is really the best place, maybe in the world, to evaluate hearing and speech in children. So
Definitely. So, if there's any thought that my child might have an ear infection or they do, go ahead and just give Boys Town a call right away, and the sooner we can get to you and get your child treated, the better. So that is great. Heather, thank you so much for joining us today. And for all of you watching, I will make sure to link in the comment section some additional resources on our website for how to get in contact with Boys Town ENT and some Knowledge Center articles as well. So thank you everyone for tuning in, and we hope you found this chat helpful.
Yes, and we have a lot of great pediatricians who would be great at helping you as well.
Yes, perfect. Thank you so much. Bye-bye.
Bye.